Hi there, it's Dr. Grant Pagdin. Today we're talking about bioidentical hormone replacement therapy. Particularly this becomes relevant for women at the menopause as the production of hormones coming out of the ovaries drops quite dramatically. This can lead to a wide variety of symptoms that are quite disconcerting, most notably hot flashes and night sweats. However, there are some silent things going on in the background as these hormones drop off. You'll be at increased risk for blood pressure and cardiovascular problems. You'll be at increased risk for osteoporosis. So these are a number of reasons why bioidentical hormone replacement could be a good idea at the menopause. Now, the women that seem to breeze through the menopause without too much symptoms at all are women that have very good adrenal function, and the adrenals do form the backup hormone system when the ovaries fail. So these are all things that we take into consideration when we're assessing the appropriateness of bioidentical hormone replacement therapy.